pleasure again to be here, but also welcoming my co-PI on the project and collaborator, Leah Thomas-Olson, who I will point out, even though we've been working on this project for over a year, and we live in the greater Metro Vancouver area, have yet to meet in person due to the COVID-19 pandemic. So at some point, I think we will meet in person and maybe even present in person, but it's a pleasure to do this with you, Leah. So I'm not going to say, I'm going to turn it over to Leah very quickly to start the presentation, just to sort of say that we're going to be sharing duties. But this is a collaboration between SPPH, UBC, and the Partnership for Work Health and Safety, as well as Fraser Health. So over to you, Leah, and welcome.
Thank you. Are you advancing the slides, or do you need me to do that?
I'll advance the slide. Just,
okay, thank you. Okay.
Or give me a thumbs up.
All right. Yes, so thank you, everyone. Thank you for the welcome. I'm happy to be here today to present our findings from our study that we collaborated with UBC on. So yeah, our title for today is The Health and Productivity Effects of Working from Home for Fraser Health Employees. Next slide. So to start off, I'd like to acknowledge our other co-investigators and our study collaborators on our research team. So our co-investigators from Fraser Health, we also had Thomas Klein-Sally, and from UBC, we had Dr. Wei Zhang and Dr. Mika Kuhorn. Our study collaborators, my colleagues from Fraser Health, Melanie G. and Remy Adejumo. And then our research team from UBC was Suhai Marino, Andrea Jones, and Jonathan Pham. Next.
Yeah, working on it.
No worries.
Maybe I'll just jump in here. We do have some Slido questions. And so if you want to type this into your smartphone, mobile device, or computer, slido.com, and then the 6-digit number that you see in front of you, 342796. You'll be all teed up to go when we get to that part of the presentation. Back to you, Leah.
Great. So Fraser Health is one of 6 health authorities in British Columbia, Canada. So at the top there, I have a map of BC, and the little green box near the bottom along the border, that's Fraser Health. But then below that, I have sort of a geographical map that represents the region. So Fraser Health is responsible for the delivery of health and community-based health services to 1.9 million people in our region, which spans 20 diverse communities from Burnaby, right on the edge of Vancouver, the boundary of Vancouver, to the Fraser Canyon, on the traditional territories of the Coast Salish and the Inkpa-Katmu nations. We have nearly 40,000 staff, medical staff, and volunteers at Fraser Health. And we're responsible for services such as 12 acute care hospitals. We have an outpatient care and surgery center. We have 7,760 long-term care beds in our region. We are responsible for mental health care, public health, home health services, and community care. So there's a lot going on at Fraser Health. Next slide, thanks. So a bit about our health and safety team at Fraser Health. Our team consists of general safety consultants, as well as specialized health and safety services in the areas of ergonomics, exposure prevention, violence prevention, occupational health, and facilities design. And the main focus of that larger group is on the prevention of injuries. And then we also have a psychological health and safety team whose focus is on workplace wellness, resilience, and well-being. Our health and safety team at Fraser Health is large. We have 53 people, but it's definitely needed with the size of our organization. And then organizationally, where we fit in is we are part of the larger people health, well-being, and safety department at Fraser Health, which is also quite large, which are 176 people that's part of that team. And then globally from there, we are part of employee experience, which is the human resource department at Fraser Health. So to give you an idea of where we're sitting in the lay of the land. Next, thanks. So we have many resources and programs for staff around workplace wellness. Our internal intranet for staff is called the Pulse, and the image on the bottom left of the screen is the landing page for the resilience and well-being. So the resources that staff can find here, they have various links to all the workplace wellness resources for them and various programs. We also have a Your Health Matters webpage, which is the top screenshot above that, where staff can also find information to support their health and well-being. Some of the programs that we offer to staff are listed here, and so they include programs like the Critical Incident Stress Management. We have our Starling Minds mental fitness program, and that is an easy to use and helpful tool to manage well-being. So its registration is free for all Fraser Health staff and medical staff and their families. And it's a cognitive behavioral therapy program designed to help people understand the connections between their thoughts, their feelings, and behaviors. We also have MindWell U, which is how people can learn to practice mindfulness through MindWell U's 30-day mindfulness program. And again, the registration is free for Fraser Health employees and medical staff and their families. We have our Care to Speak peer-to-peer program. We have psychological health and safety e-modules. We have our employee assistance program where staff can access counseling and other resources. We have COVID-19 resources and tools to manage stress and anxiety, such as our going home checklist that I included a screenshot of there. This highlights some simple steps to help support staff in deliberately transitioning between the demands of work and going home to rest and recharge. And we have a number of courses and workshops. One of our very popular ones is called The Cost of Care. And that course has been designed to assist Fraser Health employees and medical staff in alleviating the damaging effects of stress that can come from the result of providing day-to-day care for other people. Next slide, thanks. So in response to the COVID-19 pandemic, many Fraser Health employees, including those with and without clinical responsibilities, have transitioned to working from home or doing virtual work. For many employees, the transition in how we work and where we work was initially made on an expedient basis, but is now morphed into the expected work arrangement for the duration of the pandemic and possibly beyond. Work from home arrangements vary considerably at Fraser Health, with some employees working exclusively from home, others who work partially on site and at home, as well as virtual patient care, which may be performed from any location, including home, at a clinic, or in the hospital. Next slide. So we recognize that an improved understanding of how employees are responding to these new work arrangements can help inform Fraser Health how to better support our employees. So to better understand that employee experience, we partnered with UBC's Partnership for Work Health and Safety to conduct a study, and the goal of which was to identify and make recommendations on improving the psychological and physical health outcomes of Fraser Health employees working at home or doing virtual work during the COVID-19 pandemic.
Oh, I guess it's over to me. So
over to you.
So thank you very much, Leah, for that context, not only for the research opportunity, but also in terms of a little bit of an understanding of Fraser Health as a workplace, and just noting that it is actually one of the largest work employers in the province. So to get us going, this was, I think, one of the challenges that your team, faced in terms of trying to, address this issue of working from home. And of course, for those of us that I suppose have had the privilege of being able to work from home during the COVID-19 pandemic, this has also been something that our employers have been grappling with as well. So we'll just let this one go for a few minutes, or not a few minutes, but a few more seconds. And you can sort of see that distractions, work-life balance, space, control, boundaries. Again, I think this is for many of us, really is our experience of what we've experienced, what we've had to face ourselves. So just a little bit of to whet your intellectual appetite in terms of some of the questions, some of the things that we really wanted to explore, with this particular workplace. So thank you for that. So as Leah nicely laid out, we partnered with Fraser Health, and this was actually a really nice example of researchers and a research-attuned workplace like Leah's. We actually initially reached out to their research office and said, we're interested in doing that. They reached out to us, and then they actually put us in touch with Leah and other members of her team, and then we collaborated in terms of coming up with the research questions, which ultimately were really driven by the occupational health and workplace wellness needs that Fraser Health had identified with their employees who were working from home. And so, as you can see on this slide, we had two broad-based research objectives. The first one is really looking at the factors that mapped onto individual workers' preferences for working from home, and what might be some of the psychological or ergonomic or other workplace health factors that would sort of shape their desire to continue working from home. And then secondly, using a validated measure of a scale that had been recently developed and published just prior to the pandemic on e-working conditions, we also looked at the relationship between mental health and other outcomes and organizational or workplace factors as measured or appropriately tailored to e-working or working from home conditions. And this was done in the context of a workplace survey that UBC administered on behalf of Fraser Health, although it was Fraser Health and ourselves that developed the questions collectively. So last summer, or this summer, or last summer, I don't know which summer it is anymore, but it was, I think, the summer of 2021, we piloted, or we actually implemented a survey that was targeted to those individuals that had either a formal or informal relationship, working from home relationship, and within Fraser Health. So it was actually a fairly targeted and specific group of people. This was approximately around 1,100 people overall in terms of individuals that we understood had a formal or informal working relationship. So they were sent out and invited to answer the survey, and we had about 370 responses with 470 responses with about 390 responses with complete data. So that's actually pretty good if we think about in a workplace survey where you think about the underlying population was about 1,100. So our response rate is around 40%, and given my experience in terms of doing workplace surveys, 40% response rate is actually quite high, and so I think that we were quite pleased with that. We did a variety of analyses, and I'm going to go through a number of the key findings, certainly not all of the findings, some descriptive statistics and cross-tabulations, and then the research team here has done a number of modeling research to really unpack some of the relationships between working from home preferences and the factors that determine that, as well as in a second set of analyses, what is really predicting or is associated with mental health related to either working from home or organizational or workplace factors. So as I just said, we really have two study outcomes, and this is actually mapping onto two papers that we're currently writing up for publication. First paper really focuses on the work from home outcomes, and that question was a relatively straightforward question in terms of those individuals who had experience in working from home. What we really wanted to understand was what their ongoing preference was, and you can see what the question how we worded that question illustrated on the slide in front of you, really thinking about those people who would like to not work at home at all, less than half the time, more than half the time, or all of the half the time. On the other side of the equation, our focus was really mental health and also some physical outcomes, but a real focus on mental health. So thinking about self-reported, questions around the level of depression that they experienced in the past 2 weeks, level of anxiety, whether they felt burnt out from work, as well as a general mental health question. We also asked some ergonomics questions, but I think for the purposes of today's presentation, we're going to focus mostly on the mental health outcomes. We do want to make sure that we have time to get into some questions and discussion. So this was a survey that we designed collectively, and it was one of those things where we could have thought of it was a dance or a delicate trade-off between all of the things we could potentially measure and the things that we thought was important to measure, given that healthcare workers in particular are incredibly measured and surveyed, and so we wanted to really be respectful of their time. So we reduced our questions on key individual and socio-demographic variables like age, gender, family status, presence of dependents or other people in the home, for example, as well as occupation and work experience variables. And you'll see some of those specific variables portrayed in the results slide as I go through the presentation. Kind of our key kind of explanatory set of variables in terms of understanding or measuring the working context was an work-life scale that had been recently published and validated in just prior to the pandemic that looked at 4 domains. So what we might call work-life interference or work-life balance, productivity, organizational trust, and flexibility. And you'll see what some of those measures are in a few moments when we start to go through the results. So, going to transition into some of the descriptives, and I have a multiple choice question. So, thinking of this group, so these are Fraser Health employees who have been working at home, and what preference of what proportion of these individuals or what percentage of these individuals do you think would want to continue working from home all of the time? So far, 20 to 49% is the. Now we got a tie here, all right. 43, got 30 responses here, so that's almost enough for me to write and publish a paper. Maybe I'll just wait 2 more seconds here. I'm not getting any more. So here we have the winner here, or at least people think that it's 20 to 49%. So just under half of the sample would be wanting to work from home all of the time. Well, it turns out that 51% of the sample, so you're almost right, 51% of the sample, of the respondents rather, wanted to work from home, continue to work from home all of the time. And that was a little bit of a surprise to me. I actually thought it would have been like, yes, working from home more than half the time or something like that probably would have been the groups that we would have seen the highest proportion of respondents. But just on the face of it, as a general rule, 33% and 51%. So, that's 84% of the sample is saying that they'd be quite happy to work from home, continue to work from home more than half of the time, and 51% all of the time. So just on the face of it, at least for those 40% of the respondents of that group, they seem to be pretty comfortable with this working arrangement. And one thing that we probably do need to bear in mind that this is a very particular occupational group. So I mean, these tend to be people who are doing desk work, involved in meetings, maybe involved more on the kind of knowledge administration side rather than individuals that are providing direct patient care. But this was a little bit of a surprise to me, maybe because I was actually very happy to at least come back into the office at least some of the time. So I would have answered the survey a little bit different than the majority of the people who answered the survey. But a very interesting finding, and also a finding that I think just descriptively, this one slide, providing Fraser Health with information in terms of like what might be some of the things that they might want to consider going forward, given that this group of employees has indicated or demonstrated a strong preference for this particular working arrangement. I don't know if there's anything you want to add to that point, Leah, before I go into some more of the results.
No, I think you explained it well. The demographic is such that their job allows them the ability to work at home very easily. So I think that you captured that well.
Well, thank you. So moving on, let's look at a slide briefly in terms of the participant characteristics. You can see that the majority of the sample are over the age of 36 or more. So I mean it's an experienced sample, and you can certainly see that when you're looking at years work at Fraser Health, that 29% of the sample had worked at Fraser Health for 13 or more years, and in fact 50% of the sample had worked at Fraser Health for 18 or more years. So this is an experienced sample. They've been around. We're not really focusing on workers that are new to the job. In terms of gender, you can see that the majority of the sample, the vast majority of the sample, identified as being a woman. This is probably very different than what you might see across all of Fraser Health employees. Only 11% of our respondents provided direct patient care. So a real signal of kind of the type of work that they're doing. They're not providing, as a general rule, direct patient care. Also, when we look at unionization, we can see that 2/3 of the sample, were not a member of a union. They did identify that these are commonly management, or what we would see excluded workers from unions as a consequence of that. When we start to look at maybe one more slide of participant characteristics, their general physical and mental health, and in this case it's broken down by gender, but you're not really seeing much difference by gender in terms of the sample. Most people are reporting excellent or very good or good physical health. You can see that perhaps there's a little bit more of a shift in terms of the likelihood of reporting fair or poor mental health compared to that, and no real differences in gender. Thinking about people at home during working hours, a good proportion. There is no one at home during working hours, and that's actually maybe surprisingly greater for it is for women than it is for men. But the majority of the sample, it's either 1 or 0 people working at home. And then the vast majority, 93%, do not have children in the home during working hours. And so you can sort of see here that some of those sort of key determinants that we've heard in the media in terms of experiencing challenges at working from home, we're not necessarily seeing it showing up in this sample. So one more slide on productivity. So this is differences in work from home preferences by location of work, patient care, or use of Fraser Health programs or productivity. And I mean, I think what we're seeing here is that there are some associations, even though there's a large proportion of people wanting to work at home all of the time. So when you see location of work from home and virtual work, that if people are doing working virtually or from a clinic and hospital, their preferences is to at least start to going back and seeing people in person, and that sort of corresponds with what we would expect. And similarly, we see that when you're looking at providing direct patient care, those individuals that are providing direct patient care are the ones that are wanting to not work from home all of the time. Not much going on with the use of the Fraser Health support program, other than the fact that those that are there's a slight relationship between those that haven't used the program and wanting to work from home all of the time, and those that just want to work from home more than half of the time. Large association with respect to productivity, so that if you're not feeling like you're productive, you're not wanting to work from home all of the time. So descriptively, we're already seeing some kind of very interesting patterns emerge here. So a couple of other questions here descriptively. This one is looking at the impact, their self-assessed impact of working from home or virtual work on physical health or on mental health. And, for the most part, individuals here are identifying that working from home has actually had a positive effect on physical health and a positive effect on their mental health. And again, this is probably in the context of a COVID-19 pandemic, where perhaps not being able to work from home could actually expose you to risk of COVID-19. And so, we might be seeing this expressed in this particular set of questions. Descriptively looking at the mental health outcomes, so looking at depression first, 26% of the sample indicated that they experienced either mild or moderate depression in the last week. More individuals, disclosing or indicating that they experienced mild, moderate, or severe depression, and the majority of the sample is indicating that they're experiencing some level of anxiety. And again, that probably makes sense. We're in a COVID-19 pandemic. It's kind of hard to think of us going through that without at some point experiencing some anxiety. With respect to burnout, and this is a healthcare sample, almost over 60% of this sample is identifying that they are experiencing burnout, either sometimes, always, or often. With respect to self-rated mental health, most people are indicating that they're in excellent or very good health, but there is still a large group of people who are either in good or fair or poor health. So, certainly there is some really nice variability here, and there's certainly, also some areas where there might be reason to think about how, from a work health perspective, we could think about improving some of these mental health outcomes, particularly when we're thinking about issues related to burnout or anxiety. So I'm going to move forward to kind of our modeling, our more in-depth investigation of some of these factors using multivariable regression before I turn it back over to Leah to talk a little bit about how these findings are being used in Fraser Health. So our first before I do that, I do want to just talk a little bit about the work life conditions faced by workers. So again, we had 4 different scales. This is the first scale, which is the work life scale, flexibility, and you can see the types of questions that were asked on the screen there. I'm just, for purposes of time, I'm not going to read out all of the questions. But what's interesting here is that, generally speaking, with respect to flexibility, particularly question 11 as well as question 13, the sample is viewing that they have a high degree of flexibility. A little bit more of a distribution in terms of question 12. My work is so flexible, I can easily take time off working remotely. With respect to organizational trust, this is 3 items. Question 1 here, where they're looking at organization providing training and new working skills and behavior. There is some distribution there. Approximately little over 50% of the sample, are reporting lower scores there. In contrast, when we look at question 2 and 3, the vast majority of the sample are feeling like they're well supported or they have a high degree of organizational trust. With respect to productivity, you can see that again, the scores tend to be on the higher side, although there is some variability here. Perhaps the question that has the most variability would be question number 5. E-working makes me more effective to deliver against my key objectives and deliverables. But even there, about 80% are reporting that they're feeling quite comfortable in that regards. Finally, the work-life balance or interference scale, which is the scale that has the most scores. So I will sort of leave this up for about a minute so you can read through what the questions are. You will see that there is some variability here. So question 4, about 25 or just around 25% are reporting that they have lower scores on my e-work, taking up time I would like to spend with my family and friends. Question 5 is the one here that probably has the most variability. When e-working remotely, I often think about work-related problems outside of my normal working hours. And you can see that there is variability across all of these questions. So this is probably the area in kind of this e-working life scale where we saw the greatest range of scores and responses. So moving on to the multivariable responses or investigation. The first one, we were looking at preference to continue to work from home as our principal dependent variable, and then looking at a variety of psychosocial and ergonomic working conditions as predictors or as covariates. So I'm going to jump right to the model output, but before I do, I just want to have a little bit of note of interpretation. So in this study, we're using both logistic and ordinal logistic regression, and those are ordinal logistic regression is just a variant of logistic regression that allows us to sort of take into response an ordered variable such as good, very good, poor, or fair, for example, whereas logistic regression is a binary or dichotomous. And so our output is going to be presented largely in odds ratios, and I just want people to sort of bear in mind that if an odds ratio is greater than 1, it indicates a greater likelihood of wanting to continue to work from home. And if it's less than 1, it's going to sort of identify a lower likelihood of working from home. And I think for this presentation, we're just focusing on the fully adjusted models here. That's not true, we got both. But I'm just going to focus on the fully adjusted models here. So just in terms of looking at age and gender and the preference to working from home, we don't find any real response. So age and gender are not predictors in this sample of preferences to work from home. When we look at maybe health conditions here and a few other sort of working conditions, the presence of having a disability or a long-term condition, even though it was a relatively small proportion of the sample, was a strong predictor of working from a preference of wanting to work from home. And I think that makes sense. It's consistent with what we've seen in other research literature, and I would sort of say that I think that's an important signal with respect to how working from home can accommodate individuals who may have a disability or a health condition that could pose challenges in terms of working in the office. No relationship or pattern though for people at or during in home during working hours. One thing we did find is that having greater work-life balance and productivity were strongly associated with wanting to continue to work from home 100% of the time. You can see that with the odds ratios for productivity, there is almost 6, and the odds ratio for work-life balance in the adjusted model is about 2. We didn't see any relationship there really with organizational and trust, but better work-life balance, higher scores on the work-life balance scale, higher scores on the productivity scale, strongly associated with wanting to work from home 100% of the time. Not going to go into all of the ergonomic factors, but no real differences jumping up, particularly in the adjusted models with respect to any of the ergonomic factors that were measured in the survey. So, summary of that first sort of set of multivariate analysis, large proportion wanting to continue to work from home, key things that associated with that, no direct patient care responsibilities, having a disability or a long-term condition and having greater work-life balance and productivity. So moving now on to objective 2, which was looking at the association of these work-life scale and other working from home characteristics with the mental health outcomes. I'll just move right into those results. In this case, we're using Ordinal logic regression, but you can kind of interpret the odds ratio or in the same way that we've been doing that with logistic regression. So just remind you what our outcomes are and the distribution. So this is actually the distribution that we're modeling in the Ordinal logic regression. So let's also just very quickly look at the variability of our principal independent variables. And what you'll note here is that we have, even though you did see, any one item was sort of anchored against high values, that there's actually nice variability across all 3 of these, all 4 of these scales, and so that we do have sufficient variability in the sample to actually capture relationships between these organizational factors and the mental health outcomes. And that's actually a really important feature methodologically, and I think strength of the data here. So which work-life scale do you think was most strongly associated with mental health outcomes? Work-life balance, flexibility. Okay, 10 more seconds on this. We're almost up to 30. 3 more. Oh, perfect. So there we go. We got our magic number of 30. I can publish this again. So yeah, 48%. So we're getting a plurality. We're going towards work-life balance with flexibility being the next most commonly chosen. All right. Well, let's go see what our data shows. So this is just one slide, and then I've got a summary slide here. So this is work-life balance, and organizational trust was associated with decreased levels of anxiety. So in this case, we didn't find a relationship between productivity and flexibility. We did find a relationship with a lower odds of mental health. So this would be poor work-life balance is associated with poorer levels of mental health, and we also see that with organizational trust. Now, when we look at this across all of the scales, so this answers the question that I just asked, you can certainly see that with the exception of depression, where there is an association, but the association is not that well measured, not precisely measured, there's a relationship with work-life balance. So lower levels of work-life balance are associated with lower levels of all 4 of these mental health outcomes. Productivity, we don't see much of a relationship. We do see a relationship with organizational trust. It's not perhaps as strong as it is with work-life balance, but again, we are seeing it across all 4 health outcomes. And then for flexibility, we only really see it for burnout. We don't see it for depression, anxiety, or self-reported mental health. So Of the four kind of work life scales, it's organizational trust and work-life balance that we're really seeing where there's the strongest relationship. I'm going to skip through the slides that sort of look at predictor probabilities because we are kind of up for time here, and I want to give Leah an opportunity to talk a little bit about how they've used these results. I'm going to skip through these, my apologies for that, and I'm going to move to the last slide of question before I turn it back over to my co-PI, Leah, to make some concluding remarks. So if you were head of health and safety at a similar large organization, how would you use these findings? And this is a short answer question. New home offices for everyone. Improve work-life balance. Try to give people as much flexibility as possible. Give workers individual choice. Give workers an option to continue to work from home. Gather feedback from workers on their work-life balance preferences. This help establish a clear line between work from home, give workers the opportunity to get away from work. This has limited usefulness, it's really relevant only to office jobs only. Allow employees to work from home for just a couple days a week. Now let's just go. Develop tools to improve experience, suggestions. Let's go for another maybe 10 seconds. All right, I will turn it back over to you, Leah, to talk a little bit about how Fraser Health is using these findings in your own organization.
Great, thank you. So yeah, we determined 5 recommendations to optimize work from home or virtual work based on our study findings that Chris just presented. So the first one is the identification of occupations with tasks that can be completed remotely, and then implement processes for managers to support working from home for those occupations. So we know that this would allow us to identify positions that may be appropriate to work from home as a baseline denominator, which would actually inform our space planning, which is quite huge in our organization of that many people. If you don't need to predict office space and have all that leasing facility, then you can really make some influences for that organizationally. So we know that identifying these occupations would allow that to happen. It would also allow managers a more simplified way to determine if a position has been identified as potentially being applicable to work from home, and then they could complete an individual's assessment or request based on that information. It then would also allow us to know how many people are working from home and to what capacity. Is it 1 day a week, 2 days a week? And also allow us to identify particular departments that may be reluctant to approve work from home positions to sort of help overcome maybe some personal biases. So we know that this is a very important area right now that we need to make attention on. And we're currently addressing how we can actually approach this organizationally, because it's a very large undertaking, as you can imagine, to determine that. But we're hoping that maybe we can use some existing databases to maybe help us refine that information and actually get recommendation number 1 going. Secondly, we've determined that adequate technological resources and organizational training to support e-working tools on required programs and opportunities to collaborate is very important. So programs like Microsoft Office 365 and Teams were actually rolled out and introduced during the pandemic, and they have capabilities for collaboration. But with the expedited move to remote working, it's not clear how much people are aware of those capabilities that exist in those programs. So more training on that aspect is needed so people know how to use and when to use those programs to enhance engagement. We really want to ensure that remote workers still feel a sense of belonging to their team and Fraser Health as a whole. So, but also managers to lead teams remotely in this new way. So that infrastructure and IT support is really critical. So given that we found that 62% of our respondents felt work demands were higher when remote working or virtual work. Our third recommendation is for a multi-pronged approach to bring awareness and to optimize access to psychological supports to enhance skills to support work-life balance of the Fraser Health staff, and particularly those people working from home. As I highlighted before, we do have many resources available to staff, but that awareness can always be improved. So some post-study activities that are underway to implement this third recommendation is firstly provide tailored messaging to our staff working from home, and including the some key resources that we want them to know about. So we have our e-learning modules on psychological health and safety and resilience. So we have 3 modules, they're about 10 minutes each. And then also we want to get those staff to be linked to our Your Health Matters webpage that I referenced before. So then we can have some curated supports there for this staff group. Secondly, the leader training specific to supporting staff working from home. So we're going to be drawing and utilizing on this data to educate leaders on the importance of supporting staff to work from home. And we're going to be building this into our psychological health and safety manager development pathway next year in 2022. Next slide. Our fourth recommendation is to support employees by addressing psychosocial e-working conditions, including the flexible work arrangements. So again, some post-study activities and discussion for this recommendation right now. Fraser Health already has a flexible work arrangement policy. It's called work options. But addressing things like flexible work arrangements by trying to tie back into that first recommendation to identify jobs appropriate for working from home or virtual would provide more support for employees who would prefer to work from home. And then secondly, the development of a health portal is actually underway right now at Fraser Health. So this health portal will be one central integrated virtual health portal for total health, physical and psychological. And then it would contain resources for staff and medical staff. So once they signed into this health portal, we have the ability to create a specific work from home group. And then actually they would receive related supports and tips all geared towards that work group. Then our fifth recommendation is the development of processes and resources to verify physical home workspace setup for those working from home to ensure it's appropriate. And again, over 60% of our respondents indicated they spend between 2 and 6+ hours every day working on the computer video conferencing. So we want to ensure they have an appropriate setup as part of our work from home program. So our post-study activities implementing this recommendation is work is already underway to actually update our current work from home checklist. That's part of the work options agreement I just spoke about. So we felt that that checklist would be better if it included the physical ergonomic questions we actually used in this study. Because we acknowledge that it's really about the principles of setting up the workspace to achieve neutral postures for staff to be able to do at home versus the specific questions that were already in this checklist at this point. So we're amending to update the checklist to include those questions. And then in addition to that, alongside it, we're creating a manager resource guide so that managers have direction on how to address any physical ergonomic questions that may come up. That will be important for them to help reduce confusion and to have clarity around what direction they should take when people approach them with questions. And then we've already developed a work from home tip sheet for staff to understand ergonomics of their home work environment. So those are all the things done, middle, and planned with our study data.
Great. Thanks so much, Leah. And that more or less brings us to the end of the presentation. I know there was probably more than we could talk about. It was actually quite a comprehensive survey, but for those that are interested in that, there will be some papers and coming out on this next year, and we're always happy to talk to other organizations about these findings if they think they might be relevant. But I will turn it back over to the seminar host. Thank you very much for your attention.